Good morning, everyone. School Eye Health Program, a pan-India study with a sustainable Kerala model. Visual impairment is the leading cause of learning difficulty in children, and early detection and treatment of childhood eye problems has a big role in eliminating avoidable visual impairment. And for the last many years, school screening programs are undertaken in India, but many of these are not standardized and is often limited to the certain schools, as said by the Ministry of Health and Family Welfare, New Delhi. And the importance of a standardized data cannot be overemphasized. You cannot manage what you don't measure. The aim of the present study is to be part of a pan-India study of eye problems, especially refractive errors in children, to evolve a standardized testing procedure and treatment facilities, to create a model for sustainable eye care in children of India, and to compare Kerala data with other parts of India, and to assess compliance to spectacle wear. Materials and methods: we used a standardized software-based school screening program in two phases, phase 1 from 2016 to 2019 and phase 2 from 2019 to 2024 under the guidance and financial support from Orbis International. And we were happy to be included with other major institutes in India. 6 major institutes including Shankar Nethralaya, Aravind Eye Hospital from Tamil Nadu, H.V. Desai from Maharashtra, Sadhguru from Madhya Pradesh, Netra Nirmaya from West Bengal, and Little Flower Hospital participated in this study, and each hospital obtained ethical clearance from their respective institutional review boards, and an agreement was signed to share the data between all these participating institutes. And the present study consisted of a standardized testing methods and covered all schools in government, private, semi-rural, urban, all schools in a particular district. And until this study, we lacked nationwide data. Prior consent was obtained from the authorities, and a team including optometrist, project officer, optician, and an ophthalmologist visited the school and conducted eye examination. The protocol for primary screening was conducted in a classroom. Visual acuity was tested monocularly using a pocket vision screener which had a 6:9 letter type which is crowded, and the test was repeated with plus 1.5 diopter lens to uncover any hypermetropia, and torchlight examination was done to detect strabismus, etc. And autorefractors were also used, and the data entry was also fully computerized using a tablet which maintained an electronic database. And secondary examination was done by ophthalmologists to all the children who failed the first primary screening. Simultaneously, we did health education classes to the teachers, and during secondary examination, spectacles were dispensed, and children were selected for additional procedures like strabismus surgery, cataract surgery, evaluation of retina, glaucoma problems, etc. And compliance was tested 3 months later. That was the phase 1, and then after the phase 1 was over, phase 2 study was done, whereby we established a green vision center which was powered by solar energy in the district, same district, and 3 other vision centers were attached to hospitals. Each vision center was fully equipped for follow-up and spectacle dispensing. There was a full-time optometrist and a part-time pediatric ophthalmologist. Coming to the results, phase 1. This is the Kerala statistics. We did 2,64,787 children, and we picked up 13,419 refractive errors. We also picked up cases of cataract, corneal opacities, glaucoma cases, high myopes, low vision patients, nystagmus, squint and retina cases. All these cases were attended to in the base hospital, were treated. Some more details about Kerala data. We had 2,64,787 children screened in the age group of 5 to 18 years, and the boys and girls number was almost similar, and the children with refractive errors, the percentage will come to 6.01%. So the prevalence of refractive error in Kerala is 6.01% in the Trichy district. Of that, nearly 60% of the children were already wearing glasses. 40% were picked up during our study. And this is age-wise distribution of refractive errors in Kerala. All the different age groups, 5 to 9, 10 to 14, and 15 to 18 years. In all the age groups, the maximum refractive error was between the -0.5 to -3 diopter group. Between -3 to -6 diopters, it varied from 7.34% to 8.77%, and more than -6 diopter was less than 2%. Similarly, hypermetropia also was less than 2 diopter. Astigmatism, we use the spherical equivalent, so it was calculated as either myopia or hypermetropia. This is about girls. Boys also, the picture was not much different, it's almost same. And we checked a compliance test after 3 months to spectacles. We found that the compliance to spectacles was only about 71 to 80%, and the biggest barrier in Kerala is Ayurveda. And coming to comparison of data from all other institutes, this was shared to us by Orbis. In the study in Kerala, there is a 6.01% of refractive error prevalence. Madhya Pradesh is 3.08%, Maharashtra 2.39%, Tamil Nadu 4.79%, and West Bengal 1.05%. So the Kerala has the maximum prevalence of refractive error and West Bengal the least. And coming to phase 2 study, we did again screening of 2,51,843 children, and of them we found that 54% of children already wearing glasses needed new glasses. Only 46% could continue the same glasses. To conclude how this study is different, this is the first pan-India study to apply standard vision screening and data acquisition protocols, largest study involving 2 million children across India. And we found that the refractive error is maximum in Kerala, maybe due to the high literacy rates and minimal rural-urban difference in Kerala. And phase 2 study emphasized the need for continued monitoring and change of prescriptions. And this is important in future planning. Steady improvement in educational level of children may raise the number of myopia, and the pan-India data will help in planning and policy making, especially myopia control measures. Thank you for a patient hearing.
Madam, in the chart you showed quite a number of children undergoing orbit procedures.
Orbit,
what were they?
Small procedures like limbal nodule,
I think 200 patients underwent
such procedures.
I think,
and then ptosis was also there. That was also included in the orbit. Ptosis was there. Thank you.
So refractive in
that's
Kerala?
only we can only speculate. We think that Kerala has the maximum. Maybe it's because of the high literacy rate of the parents, mothers, and the children, one thing. And another thing, there is not much of a rural-urban difference in Kerala. These are all only postulations. We cannot
West
say.
Bengal,
maybe it's genetic.
West Bengal, it is only 1%.
1%. That is the study from our study.
So
and this
data was a uniform pattern. You said you had a uniform
same
pattern
kind of pattern, but it is different in different places.
The implementation was different, or it was not?
No. It was the same software which was used, same protocol. Same. Yeah, Madam knows. Thank you.
So if you were to go for some higher end refractive procedure like refractive treatment like DIMS glasses and all, it will not be working at all totally, because I think here people not
in this study we didn't do any DIMS class or myopia prevention or that has to be done. All these children are under follow up. Now we advise them. There is because of the vision centers
drops and all that.
They come to the vision centers. If the myopia is progressing, we always advised low dose atropine and myopia prevention glasses. That is done. They are connected.
A little bit because of the location also, this percentage difference which is coming on refractive. I'm just answering on behalf of Dr. Because the Vivekanand, that Bengal Center is based in absolutely rural area. In fact, it takes care of Sundarban area. Yeah, so Sundarban area 1% is probably very likely. If you go to Calcutta, you will find similar to 7 to 8%. Yes, again in our data in Tamil Nadu was also again Tiruvallur district, Kanchipuram district, and slightly government schools.
Ours was in Trichur.
So mostly government schools in Tamil Nadu. So that is almost comparable to what Madam is present.
You said the original prescription which the children were using were wrong in many percentage of cases.
Yeah, 56%, 46% could continue the same prescription. 56% we had to change. Thank you.